Welcome, ladies and gents, to another episode of Optimize Your Body podcast. And I've got an absolutely incredible, I know I say this a lot. I always say I've got an incredible guest, but I actually this is, I'm really honored to have him on, Dr. Philip Ovadia. And just a quick intro on him. So Dr. Philip Ovadia is a board certified cardiac surgeon and founder of Ovadia Heart Health, and he's performed over 3,000 heart surgeries. His mission is to optimize the public's metabolic health and help people stay off his operating table. As a heart surgeon who used to be morbidly obese himself, Dr. Ovadia has seen firsthand the failures of mainstream diets and medicine. And he's come to realize that what helped him lose over 100 pounds and keep it off, by the way, I'd like to drop that part in because that's the hard part, was the same solution that could have prevented most of the thousands of open heart surgeries he's performed, which comes back to metabolic health. So, Phil, thanks for coming on. It's an honor to have you on.
Yeah, it's great to be here with you, Martin. Really excited to have a great conversation with you and help your audience understand how they can improve their health, optimize their health, and ultimately stay off my operating table, which is what it's all about.
Fantastic. Yeah, I love that on your bio. You've got, don't be my 3,100th, or don't be my my next person on my operating table. I'm trying to avoid that at all costs. It's prevention over cure, essentially, isn't it?
Yeah, that's really what it should be about. And unfortunately, the medical system, we call it the healthcare system, but it really isn't a healthcare system. It's a sick care system. And, this is true here in the US and it's true worldwide, where all of your audience is going to be as well. We have become focused on sick care, on taking care of sick people. And we have really lost the focus on how to prevent people from being sick in the first place.
Absolutely. And it's like this in, I guess, all westernized countries now. But America, 50% of my audience are in America. So a lot of them will resonate with this, but it's kind of catching up now in Australia. I live in Australia, obviously, and the UK as well. But obviously with the healthcare system and the pharmaceuticals industry in America, that's a whole nother conversation. But if you wouldn't mind just telling us a bit more about yourself, Phil, and I'm curious to know, did you always want to become a heart surgeon? Like, was there an inspiration there, or was that just something you kind of ended up just, I wouldn't say you never fall into something like that, right? It doesn't work like that. But is that something you just kind of ended up doing, or was there an inspiration to it?
Well, I always knew I wanted to be a surgeon. I wanted to go into medicine and I wanted to be a surgeon. Heart surgery really called to me as I went through my education and my training. I found it, the combination of the technical skills necessary to perform heart surgery, but also the physiology, the understanding, of the working of the human heart, really just called to me. So I became passionate about heart surgery early in my surgical career. I went through all the training to become a heart surgeon. And, it's now been 20 plus years that I've been working as a heart surgeon. But for much of that time, I was a very unhealthy heart surgeon. And, that sounds strange. And people will think, how could a heart surgeon not understand health, not be healthy? But, I was a perfect example of it. And quite frankly, I wasn't the only one. I look at my colleagues even today, and many of my physician colleagues are very unhealthy. And, I probably fell in the trap of following my own advice and not really considering why it wasn't working. I defaulted to the usual excuses. I said, oh, it's because I'm too busy and, because I don't have time to focus on it. And I really didn't think about, maybe it's because the advice that I had been taught to give people was bad advice. And it was only when I had my eyes open to that possibility and I started to explore that and I started to change what I was doing. And I realized, I had success. And then I realized that the advice I had been giving for such a long time was wrong. And our understanding of, why people were ending up on my operating table was wrong. And so that's what has led me to kind of refocus a little bit. I still work as a heart surgeon, but I'm also actively working to keep as many people as possible from needing heart surgery.
Awesome, awesome. And metabolic health. Now, human metabolism is obviously very, very complex, right? And I'm always talking about, I'm always saying this word with clients because I'm a coach, online coach, and I help people get in shape. I help them with nutrition, training, mindset, everything that it is required really to get not just the transformation with their physique but mainly to change behaviors. As you know yourself, is the most important thing, to be able to make permanent changes, not temporary, which is a different animal. But I always talk about metabolism and the importance of, getting your metabolism essentially developed, or getting your body to burn more calories by itself and all those kind of things. But if you wouldn't mind just explaining metabolic health, that'd be great.
Yeah, it really is a concept that most people don't understand. And quite frankly, most physicians don't understand because, again, it's not part of our conversation. Despite the fact that metabolic health is at the root cause of most of the chronic disease that we face in the society. When you look at here in the US, we look at the top 10 causes of death every year, and 8 out of the 10 of them are attributable to metabolic health. So when you understand metabolic health, you truly do understand the root cause of most of our problems. So, the simple way that I try to explain metabolic health to people is when we are metabolically healthy, our bodies are using the inputs that we're giving it properly. And the primary input that we give our body is the food that we eat every day. And when we eat, one of 3 things is supposed to happen with that food. One of 3 things does happen with that food. Some of it gets turned into energy right away to use to fuel all the activities that are going on, within our bodies, all the cellular activities. Some of it gets broken down and then used to build and rebuild our tissues, another process that's always going on in the human body. And then some of it is supposed to be stored as energy for times when there isn't food available. And what has happened in our modern food environment is that system has gotten hijacked. It's got knocked out of balance. And we end up storing too much energy. We never end up using that stored energy. And that then has a whole host of downstream consequences that lead to these chronic diseases, like heart disease, like diabetes, like many forms of cancer, like Alzheimer's disease, that are just running rampant in society today. And if we're going to undo that problem of chronic illness, we have to look at metabolic health. How do we assess it and how do we fix it?
Yeah, it makes a lot of sense. And when it comes to metabolic health and weight loss, for example, obviously you've been on your own experience yourself. And just curious to know, because I know you did mention, I heard you talk about, calorie counting and, calories in versus calories out. I always have this conversation, if it was that simple, everyone would be walking around, with 6-pack abs. If it was that simple, right? We all know that's not the case. Not that people necessarily want abs, but you see where I'm going with this. So yeah, just because as I just said at the start as well, losing weight is one thing, but it's actually keeping the weight off that, 6 out of 7 people, I think research shows, fail. They lose a significant amount of weight only to gain it back. And I know you've experienced this yourself. So just curious to know what methods really work for you to get sustainable weight loss and really transform your metabolic health.
Yeah, so it really was paying attention to the types of food that I was eating more so than the amount of food that I was eating. And like you said, I had many of those attempts in the past where I would lose, good amounts of weight, but I would always gain it back and more. And that only changed when I started paying attention to the types of food that I was eating. And that is what allowed me to correct my metabolic health. And that is what allows for sustainable weight loss. Because when your body is functioning properly and when you're giving your body the proper fuel, the system just works right. And, depending on when you address it, there may be damage that takes longer to get undone, or maybe you can never get undone. But you can always improve from wherever you're starting when we focus on metabolic health. What I, try to get people to understand is that weight loss doesn't necessarily equate to better health. We can lose weight and be getting more unhealthy. And oftentimes we are. And we can be setting ourselves up for worsening future problems by doing certain things that we do to try and just lose weight. But when you focus on metabolic health, and when the outcome that you're paying attention to is better metabolic health, that's always going to lead to improvement.
Yeah, so much of that resonated with me then. And what you said there about losing weight not always being a good thing, right? Because when you lose weight, like you said then, right, you gained it back and more. I think that's what happens most of the time is it seems the body almost gets better at storing fat, right? Because it only cares about survival. It's like, okay, you're essentially starving me again. Okay, we better store some fat, or however the body works. And yeah, so just in terms of like metabolic health and muscle mass and stuff, I'm just intrigued to hear about your thoughts on strength. I know you talked about strength training, and we know it's really, really important for metabolic health, also heart health as well. I'd like to ask you first and foremost, in terms of heart health, what would you say? Would you say strength training is more effective than cardio, or would you say the other way around? I'm just curious to know your thoughts on that.
Yeah, I would say that strength training is more effective when it comes to your heart health. And again, this ties back to metabolic health. Your heart health cannot be separated from your metabolic health. So what improves one is going to improve the other. And it's pretty clear that, building and maintaining muscle is the key to improving your metabolic health and staying metabolically healthy as we age. And we see this data, when we look specifically at heart disease. We know that, the number one predictor of recovery and long-term, success, long-term good outcomes after heart surgery is, how well you can preserve muscle mass, essentially. There's a very simple test that we can do before heart surgery that is a very powerful predictor of the outcomes of heart surgery. It's called a grip strength test. It's just using a instrument to measure, how strongly you can close your hand, how strongly you can grip. And that is an amazingly powerful predictor of outcomes after heart surgery. So it's just one example of how muscle is so important in maintaining our health. And that's why I always tell people to prioritize building and maintaining muscle as they're thinking about their activities.
And would you say that's partly why they now call muscle, it's now known as the longevity organ? Why would you say they call it the longevity organ then? Obviously, the stuff you mentioned there with strength being fundamental as well, right, for longevity.
Yeah, exactly. Again, we have a whole host of data now showing that the better you can maintain muscle mass as you age, the longer you're going to live, and perhaps more importantly, the better quality of life you're going to have as well. Because when we think about what starts to happen to us as we age, and if we're losing muscle, we develop what's called sarcopenia, where we have lack of muscle. That's what sets people up to fall and break bones. That's what, confines people to wheelchairs or not allows them to, get out and do the activities that they want to do. And, when you really talk to people, people aren't necessarily looking to live longer. They're looking to live better and stay healthy longer. If you ask most people, would you rather live to 100 but spend the last 20 years of your life, in a nursing home and dependent on others to take care of you? Or would you rather live till 80 and be healthy up until the day you die? Almost everyone's going to pick, I'll be healthy until the day I die, even if I live shorter. Now, the good news is it doesn't work that way. You can live longer and live healthier. And the key to doing that is maintaining your metabolic health And a big part of that is maintaining your muscle.
Yeah, thanks for sharing. So what would you say to yourself, right? Because the old version of Phil, when you were trying to lose weight, because like you say, that can be a problem. People get so fixated with that number on the scale. And I find myself, I battle more with certain clients that I take on, but eventually when they see, for example, they feel better, first and foremost, they feel better, they perform better, they notice they're getting stronger, they notice their health is improving. But the reality is people want to improve the way their body looks. That's just most people. And when they start noticing with their clothes, for example, I have so many clients, Phil, where their weight doesn't really change. In fact, I've had some clients where their weight's gone up by about maybe, 2 to 5 pounds, but they've dropped, 2 dress sizes within 3 months or something like that, right? Because they've dropped so much body fat. Just curious to know what you would say to the old version of yourself when you were stuck in that rat race of counting calories, losing weight, gaining it back. What would you say to yourself?
Yeah, exactly what you just talked about. And it's exactly the conversation I have with patients every day as well. It's not about the number on the scale. And again, we can look at the scientific literature on this, the medical literature on this. It's pretty clear that weight is a lousy measure of outcomes. It really doesn't correlate well with any of the outcomes that we're interested in. It is about body composition. And how you look, how your clothes fit. Those are the exact metrics that I use with my patients. Waist circumference is the one measurement that I have people consistently do at home. And that is one of our 5 markers of metabolic health. And the reason that it's waist circumference and it's not weight is because the scale can fool you. If you have more muscle mass, you may not, see the weight loss. But that doesn't mean that you're not improving your health, not improving your metabolic health. And, you can be burning fat and replacing it with muscle, and you may not see that change on the scale. But exactly like you said, you'll see the change in the way your clothes fit. You'll notice the change in the way you look. And you can do something simple like a waist circumference measurement to be able to quantify that for the people who need that number to pay attention to.
Yeah, and the waist is where we carry most of the visceral fat, right? If that's how you pronounce it, the internal fat around the organs. So I guess you would say that probably if you've got excess fat around that area, around the internal organs, I would assume that's probably one of the worst things, right, for your metabolic health.
Yeah, it clearly is. And we see this, the visceral fat in particular, on a cellular level. It is its own organ, and it kind of does bad things in our body. It's where insulin resistance really seems to emanate from. A lot of the hormones that are involved in that process, they're coming from our visceral fat. So visceral fat is a very powerful marker of metabolic health. And you can look at it in a number of different ways. There are different scans and stuff that can help you measure your visceral fat. But again, the waist circumference really reflects what's going on the inside. And when you're seeing the changes in that, it really informs you about what's happening with your visceral fat levels.
And would you say the 3 big rocks? I always say you straight away went straight into nutrition when I asked you the most important thing. You said food quality, etc. Would you say, the way you train, obviously strength training and movement, how much you're moving daily, and also, sleep. Would you say those 2 are obviously the big rocks as well? And if so, why would you say that is for metabolic health?
Yeah, so those are the 3 that I always point to first. And then number 4 on that list becomes stress. But nutrition is clearly the most important factor here. The old adage about you can't outrun a bad diet, you can't, out exercise your fork, are all very true. And if you're not getting the nutrition part of it right, it is exceedingly difficult to try and overcome that with, the other parts of it. After nutrition, our activity is clearly the next most important, factor when it comes to our metabolic health. And one of the things that I try to talk with people about is that doesn't just mean exercise as we traditionally think of it. That doesn't necessarily mean going to the gym. There are plenty of people who go to the gym for an hour or 2 hours a day, and then they spend, the rest of their day doing nothing, essentially working at a desk and sitting in the car and sitting at their computer and then, going to sleep. And that is going to put you in a lot worse of a shape than someone who's just moving about throughout the day and never sees the inside of a gym. Again, understand that for the vast majority of our existence as human beings, gyms didn't exist. And today we have more gyms than ever, certainly here in the US, and I think this is the case worldwide as well. And our health is at the worst it's ever been. So the gym isn't necessarily the answer. And that's not saying that gyms are bad or exercise is bad. It's just that, they need to be used in the proper context. And finally, sleep is what brings it all together, because sleep is when your body, does the rest and rebuild process. If you're not getting adequate sleep, again, it becomes very difficult to remain metabolically healthy. We tend to make worse food choices when we don't sleep well. We have less energy to, be active throughout our day when we don't sleep well. So there's a number of reasons that sleep is vitally important to this whole process as well.
And speaking of outrunning a bad diet, right? If you wouldn't mind explaining to us, you actually made an interesting point on a recent podcast about, which I haven't heard before, in terms of, cardio making you more hungry after you've done it as well, which is a really interesting point, which when I think about it is true. But what would you say, strength training versus cardio? I know you said cardio is essentially ineffective for weight loss, or sustainable weight loss anyway, because I have this battle a lot with people and they say, oh yeah, but whenever I do cardio, I just get leaner straight away. And then it's like, but what happens after that when you stop doing it, or when your metabolism kind of adapts and essentially slows down a bit or whatever? People don't seem to get sustainable results when it comes to fat loss and cardio. It just doesn't happen. So what would you say the difference is, and why would you say cardio is essentially ineffective for weight loss?
Yeah. So again, we have the data on this. We have the data from the scientific studies, and we have the data just from looking all around us. I mean, like I said earlier, we have more gyms than we ever have had. There are more people doing more cardio than we ever have had, and we're not getting healthier. We're actually getting worse in terms of our health. And it's because of those compensatory mechanisms that you talked about. There are two problems I find with cardio. And again, I always caution this by saying, I'm not telling people not to do cardio. I'm just telling people that cardio maybe shouldn't be your priority. And you certainly shouldn't be thinking that just because you're doing cardio, you can't be paying attention to the other stuff. That cardio is going to take care of all of your issues, because clearly that doesn't work. When we do cardio, the body does adapt, and it adapts in a couple of different ways. One is it tends to make us more hungry. And, we all see it. I mean, almost every gym, certainly here in the US, every gym has a snack bar in it. And, they're usually not serving stuff that I would consider, healthy and supportive of metabolic health. It's usually shakes and bars that are highly processed, and we just tend to consume the calories that we will burn off during the cardio session. And then when you actually look at the body's level of energy expenditure throughout the day, what studies have shown is in people that do cardio, the rest of the day, the body will actually lower the amount of energy it's burning to make up for, what was burnt during the period of cardio. So that is why I'm not a big fan of cardio for weight loss. And you can look at building muscle, and what it does. And when we have more muscle, that muscle is going to be more metabolically active throughout the day. So even when you're asleep, muscle is going to be more metabolically active. So the more muscle that you build, again, you're going to be burning that excess energy 24 hours a day, as opposed to you do the cardio and you only burn the excess energy while you're doing the cardio.
Yeah, the way I say it is, so would you say it's almost like your body's automatically burning more calories instead of, manually when you do cardio, you have to do it manually, but then obviously your appetite stimulates more and stuff. But it's almost like your body's automatically burning more calories just to keep that muscle on your body. And I guess it's the whole pursuit of building muscle as well. Having high protein, you would say, maybe would have like a thermic effect on the body as well. Obviously, that's important. You mentioned food quality. Obviously, that's a big thing that comes into it, right?
Yeah, I think those are all factors as well. I think the habits, the nutritional habits that are going to support muscle building have some unique benefits in most cases, although sometimes, people go about that in a way that maybe might not be supportive of metabolic health. But ultimately, if you want to build more muscle, you're going to have to eat more protein. And, usually the more protein you're eating, the less of the other stuff that you're eating. And that's going to lead you to better metabolic health as well.
Mm. What would you say your staples are then, Phil, right? In terms of, we mentioned stress, sleep, training, nutrition. Just to give us an idea of like the things that you really focus on, like the non-negotiables, if you like, in your kind of day-to-day life, which keep you, because I know, when it comes to stress, but everything you're doing, you're a heart surgeon as well. How you deal with that kind of stuff, is really, really fascinating.
Yes. So really the nutrition is the non-negotiable for me. My priorities is always to make sure that I'm, eating in a metabolically healthy way. And for me, that's a very low carbohydrate, animal-based protein, heavy approach. And that's really the foundation. That's the non-negotiable for me. I do my best to get exercise, resistance training in, most days. But honestly, sometimes I don't. I do stay very active. That's one of the things about what I do. And again, I built the habits in to make sure that I stay active. So, right now I'm at a stand-up desk and I'm standing up while doing this podcast. And I spend a lot of time, doing podcasting and other things on the computer. And as much as possible, it's at my stand-up desk because that's getting me a little bit of extra activity. And, around the hospital, I'm always walking around the hospital, and even while I'm in surgery, I tend to kind of be, the little movements side to side to try not to be standing still too much. But, like you said, the sleep sometimes suffers. I admit it's probably my weakest area of this because I'm on a mission and there's a lot of work to do. And sometimes the sleep, falls by the wayside. And, the stress, what I tell people around stress is you can't eliminate stress. We all have stress in our lives, but it's a matter of the mindset and the habits that allow you to deal with the stress. So, surrounding yourself with a good community, friends, family, whatever it is, that just helps you to offload that stress. So it's not always sort of burning inside and having those negative effects, which stress does. Again, when you look at what stress does to our hormones, and stress causes us to, overeat, for a lot of people. So if you let that stress build up, it's a problem. I lead a very busy life and what most people would say is a very stressful life. But I just don't let it, build up inside of me. And so it doesn't become a problem for me.
Bill, how do you deal? Surely you've had a bit of pushback in the medical community, to say the least, especially being a heart surgeon, with red meats, all the red meat you eat. And I'm sure you eat eggs, right? Because they're very nutrient dense and all those kind of things. How have you had a lot of pushback? And I'm curious to know how you've dealt with that, because I eat animal based as well. And I still have this, I still have to kind of explain myself a lot to people and stuff because they think I'm going to get, heart disease and stuff.
Yeah, no, I do get a lot of pushback, but I just, I point to the evidence on all the different levels. We have been focused on a low-fat dietary approach. We have been giving the message that, red meat is bad for us, cholesterol, dietary cholesterol is bad for us, for the past 70 years. And during that time, our health has only worsened. And specifically, our heart health, the very problem that it's supposed to be solving, has worsened. So I look at that, sort of high level data, and I point out to people. How can it be that our consumption of red meat, which here in the US has fallen by approximately 40% over the past 70 years, while our incidence of diabetes, obesity, and heart disease have all been rising over the past 70 years. So how can red meat possibly be causing that? It just makes no sense when you think about it in that sense. And, I do spend a lot of time debating and explaining and, going through the narrative of cholesterol and why it is a failed explanation for heart disease. It does not explain why we get heart disease. The focus on lowering our cholesterol has not improved our situation around heart disease. And quite frankly, at this point, I get frustrated with my colleagues that they are still so beholden to this idea. And I simply, at this point, just point out to them, are you happy with the results that this is producing? Are you happy with the outcomes that your patients are getting with the advice you're giving them? And if you're not, it's time to start changing the way you think. And I recognize how hard that is to do. It was hard for me to unlearn all that I had learned around heart disease and cholesterol. But, the evidence is there, and I can no longer, just go along with that narrative just because everyone tells me you need to go along with that narrative. That just doesn't work for me as a physician. So I have, I continue to have the conversations and have the discussions and put the evidence that I am aware of out there, and understand that, it's not that doctors are trying to be ignorant. It's not that doctors are, trying to keep this information from their patients. Doctors truly don't know the information. They don't get presented with the information. Our educational system, our medical educational system, and our healthcare system has been captured, and the narrative, is not allowed to be questioned in many circumstances. But we as physicians need to change that because it's not serving our patients. And ultimately, we as physicians need to remember who we are here to serve, our patients.
I heard you talk about a particular case, Phil, when you said about a certain patient that you were dealing with and you were doing an operation with, and unfortunately you couldn't save them. And then you had to go and break the news to her daughter, I believe, right? To her kids.
Yep.
And, you did say, was that like, I know you probably had a few moments, but I wanted to give you credit first and just like, thank you for just being so courageous and actually just doing what you're doing, because, it's a tough thing to do, to go against the narrative, etc., and just, stand up and have something to really have a big impact. But was that like a particular moment for you, if you don't mind talking about that real quick in terms of that situation?
Yeah, and that really was, sort of one of the pivotal moments. It was really what brought this mission into focus for me so well. I had already started on the journey, but that incident where, a 39-year-old woman ended up on my operating table and couldn't be saved, and recognizing, what a failure of the medical system that was, how all of the signs that, should have been addressed weren't addressed, and allowed her to get to that point that she developed, a devastating cardiac problem that was not savable. And that I then had to go, tell her family, tell her children, that they were going to grow up without their mother. That was just really the last straw for me. And that was when I said, I need to start getting this message out there. I need to be keeping people off of my operating table, because no matter how good I am as a heart surgeon, no matter how good all the heart surgeons out there may be, You are never as good after you had heart surgery as you would have been if you didn't need the heart surgery in the first place. And, quite frankly, that's what I've made my mission, is to keep as many people as possible off my operating table, because the vast majority of what I do as a heart surgeon is preventable, and we should be able to keep people from needing heart surgery.
And the thing is, Phil, you can know everything you know and all the medical school and all the knowledge you have, but you've had to go through your own process yourself, right? Of actually transforming your lifestyle, transforming your relationship with food, and doing it the right way so you can keep the weight off and be metabolically healthy, right? Because when you look at, I'm sure there's plenty of heart surgeons, as you say, a lot of your colleagues may be overweight, or, doctors and stuff like that. And it's like, almost like if you haven't actually been through the process yourself and you don't know what it actually takes to be able to be metabolically healthy, it's kind of hard to communicate that, right? Unless you've lived it. Would you agree with that?
Yeah, I think there certainly are, many of my colleagues who are focused on metabolic health that maybe haven't gone through the same journey. But it's interesting how many of them have. When I go to the conferences that are focused on metabolic health and I talk to the other practitioners that are there, it is kind of amazing how often you hear the same story, that they were just, going through their career sort of as normal. And then they had a wake up call around their own health that led them to discover metabolic health, and then, led them to start talking to their patients about it. We really do not get taught this stuff in medical school. Now, I am optimistic because I do see younger physicians, medical students today, who are recognizing this and waking up about it and talking about it. And so, I hope that in the future, doctors will be paying attention to this more. And, more and more of my colleagues are waking up to it. As I go to those meetings, I do see more and more physicians from more and more different specialties there. So that is what gives me hope about the future. And ultimately, it is going to be the doctors and the patients partnering to undo the mess we're in. The healthcare system isn't going to fix itself. It really has no reason to. Right now, the healthcare system works great for everyone involved except for the patient and the doctor. Everyone else is doing great in the healthcare system. The pharmaceutical industry is doing great. The healthcare administrators are doing great. The food industry, which is adjacent to all this, is doing great. They don't have reason to change the system. So it's going to take the doctors and the patients working together to change the system ultimately.
And there's specialists and experts within their field, right? As you say, a heart surgeon, if someone's going to do heart surgery on you or someone you care about, you want it to be a good heart surgeon. It's pretty simple, right? You don't really care about all the other stuff. And that's what they're experts in, right? But the fact that they're now really going on their own journey and actually, they've been on their own transformation journey, which is then helping them become better and give better advice, is awesome. Just, I guess one more thing I wanted to ask you, and a good thing is I had our friend, Dr. Anthony Chafee on recently, Anthony. Yeah, I had him on recently, and he went deep down the rabbit hole of the saturated fat, cholesterol, and heart disease. We won't have to go there, you'd be pleased to know. We don't have to go too deep.
But we let the neurosurgeon handle that stuff, right?
Exactly. But as you say, essentially it's getting worse. People are getting fatter and sicker, really, essentially. And, technology is getting better, which is a great thing, but it's also causing people to be, I guess, more sedentary, right? In some ways. What do you think? What are your thoughts about, human health going forward and where we're going to go?
Yeah, well, I think we really only have one choice at this point, because our society is literally collapsing under its own weight. The expense of taking care of sick people, the resources that are being consumed to take care of sick people on all levels, it's simply unsustainable. So our only choice is to start improving our health. We look at the healthcare system, for instance, and we talk about there's a shortage of doctors and there's a shortage of nurses, and there aren't enough hospital beds to go around. And you can't keep expanding those resources. They're finite. But what we can change is the number of sick people. And that's what we're going to have to change one way or the other. And, you know, like I said, I believe the only way we get ourselves out of this mess is that, you know, the doctors and the patients start coming together and say, okay, we need to make ourselves healthier to relieve the burden of the system. And again, I see that happening more and more. There are more and more people waking up to this. You know, the communities are growing. The conversations are making it onto bigger platforms. And I am hopeful that we are going to turn this ship around. But like I said, I'm not waiting for the system to do it for us. I am partnering with my patients. I am partnering with my colleagues who are waking up to these same facts. And together, we are going to make the system respond to the changes that we're implementing.
Incredible stuff. So first of all, your book is Stay Off My Operating Table, right? In the background there. Yeah, that's
right there.
Yeah, there we go. Awesome. So I just I'm going to put everything in the show notes anyway, Phil, but just wanted to shout that out there anyway, just in case people don't check, but I'm sure a lot of them will. So go check his book out. And yeah, where else can where can the audience find you, and anything else you want to plug, my man? Go ahead.
Yeah, so the best way to find me is iFixHearts. My website is ifixhearts.com. On Twitter, which is where I'm most active, is at iFixHearts. You can find me on Instagram as well. You know, ultimately, I am looking to partner, you know, in as many different ways with as many different people as possible. So a ton of resources, ton of different ways that I work with patients and work with people. We have the book, we have courses, you know, we have all the educational materials. And then here in the US, I do work with people one-on-one through my telemedicine practice. And we also have a coaching program that's actually available worldwide. So be happy to connect with anyone that's looking for help in this area, looking for the resources that they need, and just come to ifixhearts.com and we'll figure out how we can work together.
Fantastic. I'll add ifixhearts.com into the show notes and everything else as well. So thanks a lot for your time today, Phil. Really appreciate it. That was an awesome, loads of really valuable content there for the audience. So thank you very much, my man.
Thank you, Martin. Keep up all the great work you're doing.
Thank you.